Hi, I'm Dr. Justin Roth. Welcome to the video testimonial portion of the website. As an upper cervical specific chiropractor, every day I come across patients that have lost all hope in finding a solution to their health problems. They've been everywhere, they've done everything, they've been told that they just have to live with it, or that it's all in their head. Here are some of my patient stories. Alright, so what brought you into the office?
Headaches.
I've been suffering for years.
Migraines, lower back pain, knee pain,
whiplash,
muscle spasms.
Over 25 years of severe lower back pain.
I was having trouble walking. I was using a cane almost all the time.
Pains in my hands and my legs, chest pains on my arm, neck pain, nausea.
For about 15 years I've been diagnosed as an acute asthmatic.
I couldn't turn my neck to my right like I do now. I will have to turn my whole body.
As of late, working on with a chiropractor for my psoas muscles and for my hips, and not getting any relief until I came here.
The upper cervical area is very complex and requires special attention. That is why upper cervical doctors are trained in the latest technology to analyze and measure upper cervical misalignments. Specialized x-rays are taken of the head and neck in order to create a customized adjustment for that particular patient. Modernized equipment and instrumentation are utilized to constantly check and monitor the function of the nervous system. This information is crucial in the patient's care because it tells the doctor when an upper cervical correction is needed, if an upper cervical correction has been made, and also when a patient is holding their adjustment. This close attention to detail is what makes all the difference in getting the patient well or not. My patients can tell you that has made all the difference for them. And what type of results did you experience?
After my adjustment? Well, after the first one, the headaches went away, and I never had another one after that. But then I also had relief with another whole separate health issue that I had had for like probably 10 years. And I would have a lot of pain after eating, and I would get, if I had too much sodium, my whole face would get swollen, my fingers, my feet, and that went away too. Getting
out of bed in the morning, I wasn't acting like a 47-year-old woman. I was acting more like a 90-year-old woman, and it took me some time for my feet to even hold my body up so that I can just walk from my bed to the bathroom. And after my first adjustment here, I was able to do that, I think, the very next day. And I have been for 3 weeks, been able to get up out of bed every morning like a person my age, and not think that I need to order a wheelchair next week. And as far as my asthma, all my symptoms have gone away.
Everything's been getting better and better, and I've been walking without my cane for about 2 weeks now, and I'm managing just fine.
Once I started having my a full adjustment, a full body adjustment, I mean, immediately I started noticing the difference.
Why do you think the adjustment has helped with not only your headaches but your other conditions?
Well, because it made the connection between my brain and my body stronger.
If I went in and said my lower back hurts, then they would just adjust my lower back. And, if I said my neck hurts, they would just adjust my neck. But this type of treatment adjusts what's the root of all the evil. And then the rest of it seems to be falling into place.
And every time I'd go to the doctor, it'd send me home with meds, which I couldn't take. And I'd give up on them, thinking that it's all in my head and I'm going to have to move on with this. And then all of a sudden I find another doctor that I think, well, maybe they can help me. And it was the same thing over and over again. to a point where I felt that my family thought it was in my head. And now today I know that it wasn't, and I feel 100% better.
So it was in your neck, right?
It was in my neck.
Anything else you want to add?
No, I am so grateful to this young man, and I wish I'd have met him years ago.